Welcome, welcome. Now let's get you prepared for surgery. That said, the better shape you are in before your surgery, the better your chances of having a safe and successful experience. In this lesson, I'll give you some strategies on how you can improve your health before you enter the operating room, and some of the ways you can prepare mentally and emotionally for your surgery. First, I will start with things you should not do. Many people think they'll never be able to enjoy food after weight loss surgery, leading them to binge before their surgery. As a result, some gain weight just prior to surgery. If you gain weight, more fat may be deposited into your liver, and your liver may become larger. The liver is located on top of the stomach, so the surgery might be harder to do. Losing weight can help shrink the liver. The truth is, after surgery, you can enjoy food, but your new stomach will give you the control to be completely satisfied by a bite or two. So treating every meal before surgery as if it were your last isn't worth the risk. The other thing you should not do is smoke. Smoking is bad whether you're having surgery or not. However, it's much more dangerous if you're having surgery. So much so that many surgeons, for good reasons, won't operate on patients who aren't able to quit smoking. This is because it might be a sign they won't have the willpower to make the lifestyle commitments needed after surgery. And your lungs won't be clear of phlegm, so your ability to breathe is made worse. They taught me in med school that not breathing is not good for you. Also, you will have an increased risk of pneumonia, and you might have difficulty waking up from anesthesia. And finally, smoking decreases the oxygen in the blood, and your body needs oxygen to heal after surgery. So you might be at increased risk of leaks or ulcers following surgery. Reach out to your primary care doctor so he can help you quit smoking today. Now you know what not to do and why. Let's review what you should do. First off, seek to be in the best shape possible before surgery. No one expects you to run a marathon, but do what you can for as long as you can, and try to do it every day. You can try walking and counting your steps. Each day, try to increase that number. Strolling through a nearby shopping mall can be a fun activity too, especially in the winter. I advise you do not take your wallet with you. Also, you could try swimming or water fitness. You might also enjoy marching in place, doing squats, or walking from one side of the shallow end of the pool to the other end. With that in mind, now is the best time to plan for an exercise program to follow before and after the surgery. You also need to plan for your return home from the hospital after your surgery to concentrate on yourself and your new way of life. You won't be able to eat and drink very much after the surgery. Still, there are a few things that will be very good to have during the first week or two. Canned broth, chicken, beef, or veggies. 4 cans should be more than enough, as you won't be consuming more than quarter a cup at a time. Sugar-free popsicle will be very refreshing and help teach you to eat slowly. Other nice things to have include pureed soup, like butternut squash, low-fat, no-sugar added yogurt, and sugar-free pudding. While you're expected to be functional and be able to walk up and down the stairs, post-surgery, some patients like to have a reclining chair to sleep in. You might want to consider having a shower chair to provide an important safety measure when showering, in case you feel dizzy. Other helpful things to have include a thermometer, liquid Tylenol, and a blender for mixing protein supplements. Alright, that's about it. I realize it's been a long lesson, but I have one final tip for you before we move on. Even if you usually avoid pictures, take some of yourself from all sides and angles in all outfits, including shorts and even your bathing suit, because these pictures will become a symbol of an important starting point for a wonderful journey. And if at any time you don't feel like you've done as well as you'd like, look at those pictures for an affirmation of your success. Many patients record their weight loss progress through pictures and measurements and make a scrapbook of their journey. It can be something you treasure and proudly display. Alright, my friend, you're doing amazing. Take a break, and when you're ready, I'll join you in the following video.